Hello, everyone. Welcome back to the Banda Global Forum, where we speak to global thinkers shaping the future of public health, leadership, and innovation. I'm your host, Dr. Banda Khalifa, and today's conversation is one I've been looking forward to. Joining us is Professor Galea, one of the most respected voices in public health. He currently serves as the Margaret C. Ryan Dean of the School of Public Health at Washington University at St. Louis, and holds the title of Eugene S. and Constance Kahn Distinguished Professor. He was the Dean of the School of Public Health at the University of Boston for almost a decade. He was also the chair of epidemiology at Columbia Mailman School of Public Health. He's had several academic posts. He's a member of the National Academy of Medicine, the editor-in-chief of JAMA Health Forum, and has been honored with numerous awards and recognitions. So in this episode, we'll be discussing what makes the Washington University's new School of Public Health distinctive, his vision for equitable graduate admission and financial access, the role of AI in public health education, and his advice to the next generation of public health leaders. So this conversation is for both prospective students, current graduate students, policymakers, and public health professionals in general. So without wasting much time, let's invite our distinguished host to the platform. Good afternoon.
Thank you, Dr. Khalifa. Thank you for having me.
Thank you so much for agreeing to speak with us. I think one of the reasons why it was interesting to hear from you was that I think for the past 2 or 3 years, I usually mentor students who want to apply to public health. And I've seen a lot of students get admission to Washington University with very good scholarship packages. So I'm like, what's happening here? Is there a new funding availability? Because most of the time, because of funding, people would go to Hopkins or other places, but I've seen a lot of my mentees enroll in your program. So it's really interesting to learn that. But before we start, will it be possible to share a brief overview of your educational journey and what really inspired you in your path to public health?
I'm trained initially as a physician. I'm Maltese. I was born and raised in Malta, which is a small island in the Mediterranean between Southern Europe and North Africa. And then I immigrated to Canada and to do medical school and became a medical doctor, practiced medicine. And then I decided to shift to public health. I moved to the United States to study public health. I went to Harvard and did a master's in Columbia for a doctorate. And the motivation was to learn how to understand the health of populations and how I can be part of the conversation about how to improve the health of populations. And so for the past 25 years, I've been in academic public health, and hopefully I've been a part of just that conversation. Deeply about creating a world where everybody can live long, healthy lives. And that is what I see the mission of public health, and that's what I'm trying to do with public health. And as you said, I've now joined Washington University in St. Louis in the middle of the United States. For anybody who would like to take out a map, you can see Washington University, St. Louis is right in the middle of the country. And I did that because I wanted to be part of this project to build a great school of public health in the middle of the country. And that is a privilege to be able to do that.
Yeah, that's as I initially said, reading through your profile, I was really inspired by that you've done so far. But I would like to go a little bit into your academic. I think the first that I will ask is an MD, master's. What made you choose DRPH instead of perhaps a PhD?
Yeah, it's a good question. It was a bit idiosyncratic. I was in Columbia at the time, and it was cheaper to do the DRPH in that context than to do the PhD, and I had no money, and so as a result, every little bit helped. And reason was DRPH you could pay by the course versus by the semester. That was an idiosyncrasy at the moment. It may not be generalizable. So The DRP I did was essentially the same as a PhD, but it was a DRPH on paper.
Okay, okay. Yeah, these days a lot of people get so worried about to PH or PhD. But it seems to me that as time goes on, those two doctoral programs is narrowing. Would you the case?
Different types of DPHs. Some of them have DRPH very much tailored to leadership and kind of path. At Boston University, where I had the privilege of serving as dean for 10 years, that was the DRPH, and if that's for people, then that's what they should do. The truth is, what matters more from a career trajectory is what you do with the doctorate, not so much the doctorate. So, yes, I think you should think carefully about the degree you're getting, but at the same time, what you do with it matters more than the degree itself.
So I know like you've multiple top institutions, and now you're at Washington. What were some of the key turning points or decisions that shaped your trajectory?
Um, back to school and do a master's was a enormous inflection for me. As a doctor, I was working, seeing patients, to decide to go back to school. So essentially, I went back to school when I was almost 30, and which is old back to school. And I that was a big turning point. I don't regret it at all. I do enjoy the academic world. It's been a privilege to be in the academic world, and I have liked the opportunity it has given me to meet interesting people and to do interesting work. So I feel very privileged to have done that. But that was for me a key turning point.
Awesome, awesome. So I want us to talk a bit about the graduate process. You currently the dean of Washington University, which I would say is relatively new compared to the old folks.
It is
So
new. It is 6 months old.
wow, wow.
So
So so as you the admissions vision at Washington University's new School of Public Health, what are some of the guiding principles in creating, say, a more and a high impact admissions experience?
we want excellent students from all over the world, and we want students who are committed to the vision of public health. And we want students who we know are going to be consequential and make a difference in the world. As you said in your preface, we actually have historically had a large number of students from outside the US, particularly from Africa. And we hope to maintain that. And we welcome anybody who would like to be a leader in the field and who we think has potential to be a leader in the field and who would like to realize their path through engagement with us.
Okay. So, as public health grow more competitive, what specifically do you believe perhaps the admissions committee at Washington University are truly for?
I won't speak for our admissions committee, but I will speak for all admissions anywhere, which is what the admissions want to see is that you are to be a good candidate who are going to realize your potential, particularly in reference to that program. People want to know that you have done your homework and that you are going to be a contributor to the program you're applying to. Everybody understands you're applying to many programs, but you need to make the case about why you are a good fit in that particular program, and that's why you have the trajectory and the willingness to engage in the hard work of the program to become an excellent contributing professional. That, I think, is what all admissions committees want to see.
Okay, okay. So, say applying to university, I know most schools different requirements. What are major and what are maybe GRE is still required for school public health?
I would encourage people to look at our website. Because if I say things right now, I'm going to get things wrong. All this information is on the website, and people should do their homework by looking at the website. And also, we have an admissions team who are expert, and you should feel free to reach out to them. And their job is to answer questions. So I would encourage people to do their homework, looking at the websites, and talk to admissions teams.
Okay. So One important for every international student is that of scholarships and financial aid. I have to say that many of the mentees who are admitted to WashU received some funding, and it's really refreshing to see. So, what drives focus on maybe access, and how do you envision maybe the program scaling it?
Yeah, the our to help all good students come to our program. Sometimes that's not possible, but we certainly try, and we try to find the resources to support all good students. And that is obviously work within the pragmatic reality, but we do offer scholarships. Some are on our website. We also offer some merit scholarships. And again, I would encourage anybody to talk to our admissions officers about that.
Okay. All right. So I know, like, I've seen you on several platforms talking about health, how to live. So I want to look a bit about the future of, what really positions Washington University to be one of the leaders in. So as you lead the formation of this new school, what do you see as the unique strengths and differentiators of our program?
We are that encourages people to think differently, to adopt novel methods, to think about work that is consequential, that can make a difference in policy and in the real world, and a program that teaches people how to create partnerships and to engage partnerships that are both traditional within governmental and academic public health and less traditional within and if anybody's interested, please take a look at our website. You'll see our strategic plan. We talk about 4 new directions in the field, 4 strategies we are using to execute on these 4 directions. And that is what we are doing. And we're trying to be very disciplined and focusing on that.
Okay. And so is I know, like, recently Hopkins, I think, and few institutions introduced or made AI available to all students, all the faculty. Um, but you've Boston and Columbia and other public health institutions. w- What do you think is the role of AI in education?
Yeah, when I new approaches, I think about AI. We think about how that's going to be part of the armamentarium of the new students and when they become professionals. And that's exactly what students what be learning. They need to know how to use AI as one of the tools. And my goal is to have an education program not to teach students what to think, but to teach students how to think. Because I don't know what the key questions our students today are going to be facing 25 years from now. I don't know what questions they're going to be facing 40 years from now. As finishes our program, will be at the peak of their career in 25 years. They'll still be in the field in 40 years. And so our job is to help give them the tools to learn how to think so they can apply it to the problems at hand.
Okay. All right. So I will pick to perhaps one area that a lot of prospective applicants, when they come to me, they are worried. Is public education dead? Is public health career dead? They see the um, public health. What is the future of public health, in
Well,
your opinion?
I think if we as a society are willing to say that we don't mind people dying young from heart disease and having their cancer go undetected, and mothers dying in childbirth, and newborns dying from infectious disease, and local epidemics becoming global pandemics. If we don't mind any of that, then I think we don't need public health.
Yeah. Okay. Students who are still enrolling in what advice you would give such students? How can they be prepared
Look,
for
it's
that
a
level of uncertainty?
it's an interesting and noble profession. The world is always going to need it, and I think you can have a very satisfying, rewarding career in public health. So I want to encourage prospective students to lean in, have the courage to do something that matters for the world, that is interesting. To prepare, as with the more you can actually make sure that you have connections to in the field, the better it's going to situate you. And I think I want you to be the best possible candidate you can be. And I think you do that by engaging, seeing if you can be part of public health practice or academics, anything that you think is right.
Awesome, awesome. So I think we've all the areas that I wanted us to talk about. But before we give you any any word of advice to
Yes.
early career professionals, graduate students, applicants,
Look,
elsewhere.
I, I care a lot about public health. I care a lot about the vision of public health. And my job is to make sure that excellent people, like people who might be listening to this podcast, who are interested in public health, engage in public health. And if you think the best fit for you is Washington University, we welcome you. If you think the best fit for you is Johns Hopkins, that's great as well. My interest is in having a global workforce of excellent people who are committed to the mission of public health. And if you think that's you, I would encourage you not to be deterred and to move forward.
Thank you so much for making to chat us. I'm very sure our viewers and listeners will be able to listen to this podcast. So thank you so much for joining us today.
Thank you, Dr. Khalifa.